Hello everyone, welcome to Aristo's virtual learning series. Today with this module we are going to understand about basics of common digestive problem, and that is constipation. During constipation, bowel movement may not be regular. One who is constipated has the feeling of unsatisfactory defecation, and it is characterized by a very hard pellet-like stools which are difficult to pass. And for this, many of the times we have to apply strain, that is abdominal pressure. One is said to be constipated if he or she starts having bowel movement less than 3 times a week. As per National Health Portal, the overall prevalence of self-reported constipation is 24 to 37% in India. If we look at the prevalence, every 1 in 4 adults suffer from constipation. If I look at gender wise, women are almost suffer twice than that of men. If I look for children's, so 1 in 10 children presented to the medical attention for problem of constipation, and in India around 17 million cases of constipation reported annually. Let's focus on causes of this common GI problem, that is constipation. One of the prominent cause is age. So elderly persons suffer mostly from the constipation. Along with it, if we take inadequate fluid intake, so this leads to the formation of hard stools. If our lifestyle is sedentary lifestyle, if we are not being active, so this lack of exercise slows down the GI muscle contraction. Along with that, if the person is consuming medicines such as narcotics or opioid drugs, it may lead to the slower GI motility, which land up the patient into constipation. Then inadequate dietary fibers leads to the lack of bulk to the stools, and withholding is one of the prominent cause to refuse the urge of defecation is another reason or cause for constipation. Along with this, there are some other causes as that of our lifestyle, stress, consuming too much alcohol or caffeine product are other causes. Let's sum up the sign and symptoms of constipation. So abdominal bloating, abdominal distension, abdominal pain, indigestion are the prominent symptoms of constipation. Because of this unsatisfactory defecation, there is always a sensation of fullness. Patient may experience headache, fatigue, and may feel lethargic. There is a decreased appetite. Along with that, there are gurgling, rumbling bowel sounds are there in the constipated patient. There is a sensation of incomplete evacuation, and many of the time straining during bowel movement is experienced in this patient. And there is a passage of small, hard, dry stools at the time of defecation. So below mentioned are some of the patient profile in which constipation is really very common. We will understand this patient profile one by one. So in elderly patient, the prevalence for constipation is almost 50%, and the causes are mainly age, lack of exercise, mobility because of age. Elderly people have inadequate diet or more of the fluid intake, and they are consuming certain medications which are responsible for slowing down the GI motility. Along with age, reflexes as a part of aging process, there is decreased GI motility, decreased GI secretions, there is a loss of appetite, and elder person refuses the fluid intake. There is a decrease in thirst sensation which leads to the formation of harder stools. So diabetics are more prone for the constipation. Constipation is the common complaint in diabetic patient and which range as high as that of 22%. And one of the prominent cause is neuropathy, that is damage to the neurons, which leads to the slower peristalsis or GI motility. Because of this, there is constipation. Then, constipation in children. The incidences are as high as that of 30%, and one of the prominent reason is withholding, refusal for defecation because of many reasons. And along with this, there is a less water and fiber intake into the children's diet, and the change in daily routine is another cause. Along with this, the medication as that of iron supplement may contribute to the constipation in children. Constipation even observed in the patients post-surgery, and the reasons are giving anesthesia which reduces the GI motility or the work of GI epithelial cells, then lack of mobility and exercise because of post-operative condition, the change in the food pattern, more of the liquid diet is given to the patient, and these patients are also on some medication, and along with this there is a stress in post-operative patient which leads to the constipation. The prominent patient profile is pregnant woman. So pregnancy and constipation goes hand in hand. Incidences are ranges between 19 to 31%, and the causes are increased pressure on the colon due to growing fetus. Another prominent reason is the hormonal changes into the pregnant woman. There are high level of estrogen. Then decreased maternal activity and medication as that of iron therapy contribute to the constipation. Then certain medication leads to constipation as that of opioid like morphine. They are reduce the churning movement or overall motility of GI. Like iron supplements like ferrous sulfate also contributes to the constipation. Now let's focus on pathophysiology of constipation. As you all are aware, the stool formation or the feces formation is the role of colon, that is our large intestine. So let's first focus on large intestine. So let's focus on parts of large intestine or colon. So the first part of large intestine is cecum. This is the part where ileum passes the chyme to the large intestine, above which there is ascending colon, and this ascending colon then continued with the transverse colon. Then this transverse colon will continue to the descending colon and sigmoidal colon, and the last part of large intestine is rectum. So let's understand the important colonic function. So one of the prominent function is maintenance of water balance of the body. The colon lining contains epithelial cells that absorbs various fluids and other substances like vitamin and electrolyte from the lumen of large intestine in order to maintain this water balance of the body through the process of reabsorption. Another most prominent function of colon is the processing of waste material or undigested food, and that leads to the formation of feces. And once the stools are formed, so the another major role which is played by colon is expulsion of these feces. Whenever these feces are formed in transverse colon, descending colon carries this and adds into the sigmoid colon with the swift peristalsis. Prior to defecation, this waste material or feces are emptied into the last part of large intestine, that is rectum. So for performing this colonic function, colon has to be in healthy condition, and who maintains the colon health? Yes, your guesses are right. So the gut microbiota, this 100 trillion microbes maintain the colonic health. There are more than 1,000 species of microbes resides in our gut, which we have already seen in our session of probiotics. And mainly out of this gut microbiota, the beneficial bacteria like lactic acid bacteria, bifidobacteria are the main species, along with pathogenic bacteria Escherichia coli. So these microorganisms takes care of gut microbiota health, and they contribute their part in performing normal colonic function. Friendly bacteria lives and grows along the colon lining. They mainly use dietary fibers we consume to make their food and sustain inside. So they ferment dietary fibers into short chain fatty acids, namely acetate, propionate, and butyrate. And these short chain fatty acids exerts beneficial effect on the colonic health and colonic function. Let's understand the importance of SCFA in the process of defecation. SCFA is a weak acid and it serves as energy for colonic epithelium, and it irritates nerve ending, which results into release of acetylcholine, an excitatory neurotransmitter, thereby increases peristalsis. Along with it, SCFA has water drawing and retaining capacity. That's why more amount of water is present into the intestinal lumen, which results into the formation of soft feces. Along with this, SCFA is utilized as food for bacteria and thereby increases microbial mass of gut microbiota, which adds to the bulk, and thereby it provides bulk to the feces and thereby facilitates easy defecation. So what happens actually in constipation is there is a decrease in the peristalsis. Slower GI motility leads to constipation. There is a decrease in water content in the stools. Thereby, there is a formation of hard pellet-like stools. And as there is no dietary fibers, there is no microbial mass, so there is a less bulk provided. So there is a decrease in bulk. So these are the main problems in constipation. Friends, this is picture of anal canal. Anal canal is a terminal part of large intestine. It is situated between rectum and anus. It is approximately 2.5 to 4 cm long. Once the feces is deposited into the rectum, the process of defecation initiated with series of defecation reflexes. In anal canal, there is presence of dentate line. Dentate line is located around 2 cm above the anus. Above dentate line, there is lack of nerve responsible for pain sensation, while in the region below dentate line, nerve for pain sensation are present. This anorectal area is also provided with blood vessels and connective tissue, which serves as cushion for the below area of sphincters, internal and external sphincters. These are also known as hemorrhoid plexus. Then it is surrounded by inner involuntary and outer voluntary sphincters, which keeps lumen closed except during the defecation of stools. So internal sphincters are present above the dentate line, while external sphincters are present below the dentate line. Chronic constipation is a major cause of hemorrhoids. Prolonged straining, increased abdominal pressure contributes to the formation of these hemorrhoids. Hemorrhoids is the term which is derived from the two Greek words, that is hema means blood and rous means flowing. The common term which is used into the Indian settings for hemorrhoids is piles. So hemorrhoids are mass of dilated veins in the anorectal region. The hemorrhoid not only bulge but descend into the lumen and are seen as prolapse hemorrhoids. Depending on location, there are two types of hemorrhoids. Above dentate line, there is a presence of internal hemorrhoids. They are located above dentate line and they are painless due to lack of nerve fibers for pain, and their presence can be suspected by blood covering the stools. They can protrude during the bowel movement, and another one is external hemorrhoids. External hemorrhoids present below the dentate line and they are very painful. It is also characterized by the severe irritation, itching, burning sensation and bleeding. It may appear blue in color. Overall, these hemorrhoids, may it be internal hemorrhoid or external hemorrhoid, are really a painful affair. So hemorrhoids or piles is really a socially embarrassing condition. So the common symptoms of hemorrhoids such as there will be a rectal bleeding, there will be anal pain, and one of the prominent symptom is anal and rectal itching, then feeling of rectal fullness, soiling of underwear, then bulging of tissues from the rectum, and difficulty in the cleaning after a bowel movement because of this protruded hemorrhoid plexus. Hemorrhoids are segregated in 4 different grades depending on the severity of hemorrhoids. If I talk about stage 1 hemorrhoids, so there is no protrusion of hemorrhoids in the first stage or first grade. In second grade, there is a protruding hemorrhoids but which are spontaneously reduced once we release the pressure. Then over the period of time, these protruding hemorrhoids are not going back or not reduced on their own. So possibly we have to push them back manually because they lose the elasticity. And in the stage 4, these protruding hemorrhoids that cannot be pushed back in manually anymore, and that's why they need to be treated surgically. So friends, if we don't manage constipation properly, so in long term it may lead to the severe complications such as hemorrhoids or piles, which we have already discussed. Not only this, it may also lead to the formation of anal fissures. An anal fissure is a tear in the skin around the opening of anus. This may be during the passage of hard stools through the anus. So there may be a cut and which leads to the tearing of the anal skin, and there is presence of mild bleeding. Not only this, there may be a cases of rectal prolapse. This is the condition where a section of wall of rectum prolapses, that is falls down from its original anatomical position. And fecal impaction. So fecal impaction is nothing but formation of a solid immobile bulk of feces that can develop in the rectum as a result of chronic constipation. With this module, up till now, we have understood the basics of constipation. What is the problem of constipation? And now, if we want to manage this constipation well, we have to address all the issues, that is as such the lower peristalsis, lower availability of the water into the abdominal lumen, formation of hard stools, how to provide bulk to this formation of the stool formation process, what are the effective ways to manage chronic constipation in the patient like diabetic patient, and how to avoid the further complication of constipation, and if there are any complication occurred in a patient, how to treat this complication of piles. So we will look all these aspects in our next module on the management of constipation and its complication. So thank you. Stay home, stay safe.